Okay, good afternoon. I am Betty Casey. I'm editor of TulsaKids magazine. We're partnering with the Children's Hospital at St. Francis to bring parents information about their children's health. You can find more about this information and more from this series on our website and in the print edition of TulsaKids as well. Today, we're talking to Dr. Rohit Josyabhatla, and he is a fellowship trained pediatric gastroenterologist with Warren Clinic and the Children's Hospital at St. Francis. His residency was at Rutgers New Jersey Medical School, and his fellowship was at the University of Texas Health Science Center. He specializes in the diagnosis, treatment, and prevention of a wide range of gastrointestinal conditions related to the digestive system, liver, pancreas, and nutrition in infants, children, and teens. So welcome, Dr. Josyabhatla.
Thank you for having me.
Okay, first, a lot of us may not know exactly what a gastroenterologist does. So could you tell us a little bit about what your specialty is?
Yes. So a gastroenterologist is a doctor who takes care of diseases that are associated with the gastrointestinal system. And the gastrointestinal system extends from the mouth all the way down to your large intestine or the colon. And the parts of the gastrointestinal system are also the liver and the pancreas. We are also trained to take care of children who have problems with nutrition. We are also trained in doing procedures like endoscopy that can help diagnose some of these conditions and also treat some of these conditions.
Okay, so what are some of the most common gastrointestinal conditions that you see in children?
We see a wide variety, like you had earlier mentioned, some in the hospital, some in the clinic, and some in the emergency room setting. Some of the more common conditions that we are asked to help out with are things like reflux, constipation, chronic abdominal pain. We also take care of children who have feeding problems, some who have difficulty with gaining weight, some who require a different type of way to provide the nutrition, like a G tube. We also take care of kids who have allergy-like conditions like celiac disease or milk protein allergy or eosinophilic esophagitis. We also take care of kids who have chronic inflammatory conditions like inflammatory bowel disease. We're also some of the common liver diseases that we see are fatty liver disease. We also take care of some emergent conditions like upper gastrointestinal bleeding, swallowed foreign objects, and also food impaction.
Oh, wow. That's a wide variety of things.
Right.
Let's talk just for a minute. You mentioned fatty liver, and we did not talk about this, but is that on the rise, the fatty liver disease, or is that an inherited or genetic condition? What is that?
So it is a condition where there's accumulation of fat in the liver. It seems to be on the rise. It's become increasingly common, particularly in childhood. Previously, it used to be a disease of the adults, but with the rising prevalence of obesity, fatty liver disease seems to be on the rise as well. Oftentimes, it's seen in association with conditions like diabetes and hypertension. In kids, sometimes it can present by itself. This, when caught early, is a reversible condition. You can treat it mainly with exercise and diet, and the liver tends to go back to being its normal self. But left untreated, sometimes it can lead to long-term inflammation and then problems with scarring like cirrhosis.
I did want to ask you about that because I have gotten information at my office about fatty liver disease being on the rise in children, and you have just confirmed that. What are another condition that you hear about fairly often is reflux. Can you talk a little bit about that and what the signs and symptoms of that might be?
Yeah, reflux is an extremely common condition that we see, particularly in younger kids who are under the age of 1 year old. Reflux is different from reflux disease. Reflux is just the process of food coming up from your stomach into the esophagus. When that comes up all the way, it's called regurgitation. And sometimes if that causes inflammation or irritation in the esophagus, it's called gastroesophageal reflux disease. A majority of the infants who have reflux tend to not have problems from reflux. They are sometimes called as happy spitters because they tend to reflux a lot through the day, but then that does not seem to interfere with their ability to eat or their eagerness to feed. They continue to gain weight, and with time, it seems to go down. Most of them outgrow it by the time of 6 to 8 months. Most often, it completely subsides by the time they're about a year or a year and a half old. In some cases, reflux could either be severe enough where it could lead to severe irritability associated with feeds, or when there's irritation in the esophagus, it can reach a point where the infants start to avoid feeding and then may lose weight. In those kind of situations, we tend to treat reflux a little bit more carefully. Initially, simple measures that can be instituted are things like positional therapy, wherein we ask the parents to hold the child up after feeding. Sometimes, if there's any kind of tobacco exposure in the household, we try to educate parents about trying to eliminate that. Other options that we use are things like thickening of the milk using either oat cereal or things like commercial thickeners. Rarely, reflux could be secondary to a kind of milk protein allergy. And in those situations, maybe using an alternate formula, like a more hydrolyzed formula or a special formula, can help decrease the frequency of reflux. And one thing that we also try to keep in mind is when kids have reflux leading to a point where they're losing weight, reflux could also be a sign of other conditions like genetic conditions or metabolic conditions. Sometimes conditions that can cause an increased pressure in your brain could also cause reflux and vomiting. So when kids have prolonged periods of reflux and they have problems with weight gain, then those are some of the other conditions that we evaluate for as well.
Okay. So it sounds like it's something that many times infants will sort of outgrow, but it could be a sign of a more major issue. So if parents are seeing these symptoms and their infant is having reflux, then they should definitely speak to their pediatrician or their healthcare provider about that.
Definitely, yeah. I think as a first step, they should definitely bring it up and talk to their pediatrician about it so that they can assess the extent of reflux and the severity of reflux. And then based on how severe the symptoms are, and particularly if it starts to interfere with their weight gain and their growth and their developmental milestones, that's when it needs to be looked at more carefully to make sure that one, if this is something that's not gastrointestinal related, then you try to identify that and treat it. And if it is GI related, you try to see if this is something that can be treated medically or if this is something that requires a surgical fix. And that's where we come in.
Right. Okay. Yes. Thank goodness for you. Another condition that you mentioned that is on the rise is I'm looking for it. EOE.
Right.
I don't know what that stands for, but you had mentioned you're seeing more of that. Could you talk about that a little bit and what the symptoms are of that?
Absolutely. So EOE is an abbreviation for this condition, which is called eosinophilic esophagitis. Eosinophils are a particular type of white blood cell that participate in allergy-mediated reactions. And esophagitis is a term that just refers to inflammation in the food pipe or the esophagus. So in this particular condition, which is EOE, these eosinophils, they come and line the esophagus and then tend to cause inflammation, leading to problems with the way the esophagus functions. So this condition was not known before the 1990s. It seems like there've been more reports since the 1990s, and with time, as the awareness has increased about this condition, we are also recognizing it and looking for it. And with that, we've found that the prevalence has also increased. This is a condition where the current understanding is that there is some kind of a trigger which is either in the food or in the air, and that tends to localize in the upper part of the esophagus or through the esophagus and then cause this immune-mediated reaction. This condition tends to go along with other allergy-mediated conditions like asthma, eczema, and seasonal allergies. For some reason, it has a slightly higher preponderance in males as compared to females, and it's seen in all age groups. The way this condition presents also varies based on the age of the child. Younger kids typically tend to present with vomiting and difficulty gaining weight. Older children tend to present with pain in the belly, sometimes with reflux-like symptoms, and occasionally they may have difficulty with swallowing. Parents may note that kids are taking more time to chew on solids. Sometimes they may say that kids are drinking more water when they're eating to push things along. And rarely, kids may present directly to the emergency room with a food impaction, where particularly dry meats like a piece of steak or a pork chop or a hot dog may get stuck in the esophagus and not move. So they may start having drooling, and that's one of the common presentations of this condition as well.
And you say that's that there's some indication that that is related to allergies, either food or something in the air. So if your child does have allergies, is that something that parents might watch for?
Yes, definitely. I think if someone has asthma or eczema and starts to have some of these symptoms, then they should be closely monitored for worsening signs and symptoms. And certainly, if they have a clinical spectrum that's consistent with EOE, then the pediatrician should refer them to us. Sometimes these patients are referred to us even by the pulmonologist or the lung doctors, who see that kids who have asthma may start complaining of difficulty with swallowing, and then they get referred to us. And then we diagnose this condition by doing testing.
And what is the treatment for that?
So this condition, firstly, the way to diagnose this condition is only by endoscopy. Unfortunately, the inflammation is limited to the lining of the esophagus. So blood tests and breath tests and other forms of imaging like an X-ray may not be adequate in diagnosing this condition. So we often tend to go in with an endoscope, take a look at the way the mucosa looks, and then also do biopsies to determine the level of these eosinophils and then make a diagnosis. Once a diagnosis is made, we do work with our allergy colleagues to see if we can identify potential food allergens. And if we do find an allergen, then one strategy is to try to take out some of these more common food allergens that they could be allergic to. That strategy may or may not work always, but that is one option that we have at our disposal. Other options would include use of long-term antacids like proton pump inhibitors, and another option is to take swallowed steroids that particularly are given in the form of a slurry, so that the steroid coats the lining of the esophagus and then acts locally to control the inflammation.
Okay, so there are several different ways to treat that. What are some of the other conditions that you see? I mean, are there like some like celiac, or a lot of parents think their children shouldn't be eating wheat, or are those accurate, or what kinds of other things should parents know in terms of common diseases and things or conditions?
Yeah, celiac disease is definitely a very common condition. Celiac disease is it's a kind of a sensitivity, which is again immune mediated, where adults as well as children are they mount an immune reaction to a protein which is present in gluten. The protein is gluten, which is present in wheat or rye or barley. This immune reaction typically tends to affect the small intestine and then cause symptoms of gastrointestinal disease, and sometimes can actually not cause overt symptoms, but can cause nutritional deficiencies, which then eventually lead to symptoms. There are blood tests that you can do to screen for celiac disease, which serve as an initial test to at least capture some of these patients. And then most of these patients will require an endoscopy to confirm the diagnosis. Celiac disease is highly prevalent. It's almost present at a rate of 1 in every 100 individuals in the US. And I think that's why we have more options available in the stores as well when it comes to gluten-free products. There are some individuals who are also at higher risk of celiac disease, patients who have early onset diabetes, other autoimmune conditions, and patients who have a family history of celiac disease need to be closely screened for this, particularly if they have any kind of GI symptoms.
Mhm. Okay, and the symptoms of that are what? Diarrhea, weight loss? What are the symptoms of that
So,
disease?
celiac disease can present in a whole myriad of ways. Oftentimes, it presents with diarrhea and abdominal pain and bloating. But sometimes it can present with symptoms that are completely unrelated to the GI tract. It can present with joint pains. There are reports of headaches, which are then diagnosed as celiac disease. So when there is a family history and when they're at a higher risk with coexisting autoimmune diseases, then you certainly want to screen for celiac disease. But in others, when they start to have these symptoms of GI disease, then at that point, they should be screened for celiac.
Okay. Are there other, we've just touched on some of the conditions and diseases that you deal with, and it does sound like it can be a complicated type of, these things can be complicated if they're related to allergies or maybe smoking in the home or or asthma. Um, what other kinds of things should parents know about gastrointestinal problems, and when should they be concerned?
Yeah, I think symptoms that start to interfere with quality of life, particularly if you have chronic abdominal pain, if you have diarrhea that's starting to interfere with your day-to-day life, signs of bloody diarrhea or vomiting, and particularly if you see blood in the vomit, these are conditions that should prompt you to immediately seek an opinion or care from a gastroenterologist. Other conditions where you would want to like come in and seek care, particularly things like weight loss or difficulty with gaining weight in children over a long period of time. We do see that one thing which is very common in kids, particularly younger kids, are foreign bodies, where kids tend to swallow objects, and that can lead to problems. Some of these objects can lead to severe damage in the esophagus and cause long-term scarring. Some of these are things like button batteries, coins, and then caustic objects like dishwasher pods or just washing machine pods. These need to be very carefully locked away and kept out of hand from children. Particularly when it comes to button batteries and caustic substances, they tend to cause damage very quickly because they tend to get stuck in the esophagus and then can cause a lot of damage and corrosion. So in these cases, the best option is to prevent, particularly in younger kids who are curious and want to put some of these things in their mouth and then may inadvertently swallow these objects. The first thing is to try and make sure that these are, when it comes to button batteries, make sure that one, they're either kept in locked cabinets, or if they're in toys, make sure that they're not in toys that are easily openable and then from where you can access them. And with these caustic injections, it's very important that you keep them in cupboards that are out of reach from the children as well. And then if it so happens that kids do end up taking it and swallowing it, then these are emergent conditions where you should be brought into the emergency room at the earliest, so that you can have imaging done, and then if needed, have an endoscopy done to assess the damage, or if there's a foreign body, take it out.
Mhm. Yeah, those button batteries, just to clarify, those are those little round batteries that are often in toys. I don't know if they've been banned, but maybe they should be. But yeah, if a child does swallow those, or you suspect that a child has swallowed one, go to the emergency room, correct?
Exactly, yeah, because those tend to be the size of a quarter, and what
Yes.
often happens is your esophagus is about the same size. So there are areas where the button battery can just get dislodged and doesn't move. And when it stays that way, it tends to discharge its current and then cause damage to that area. And if the longer it stays, the higher the chance that the damage can be more severe. So in those cases, it's very important that they seek care right away and not delay.
Mhm. So we need to be diligent as parents to prevent these things before they happen and keep all of these dangerous objects away from our children or where they
Absolutely.
can't reach them. And kids can be pretty clever at getting those things too.
Exactly.
So be
Right.
careful. Um, I have a final question about, I think parents, especially parents of infants, are concerned about poop. Um, is, are there times that, are there things that we need to be concerned about? I mean, weight loss, changes, what is it, if we're noticing something, what should we be looking for?
Yeah, that's one of the most common reasons for patients to come in and see us. Most of the times, or rather, a majority of the times, constipation seems to be unrelated to a clear cause where we've not been able to, where we do some tests, we do imaging, and we don't really find out a clear cause. And in most of these situations, it seems like it gets better with either just in changes in your diet by increasing fruit and vegetable intake or fiber intake. Sometimes using a stool softener on a regular basis helps, and sometimes just having a regular toilet schedule also seems to help. Sometimes these are changes in the home setting or school setting, and stress can lead to constipation. So addressing that often helps take care of some of these symptoms. But when it starts to interfere with their diet, when it starts to cause a lot of pain, because constipation can be associated with pain and bloating, sometimes it can be severe enough to the point where it leads to recurrent vomiting and decreased appetite, and then difficulty with gaining weight. Those would all be indications when need to seek medical care and see if there are other medications that you can use to see if you can treat this better. In a small fraction of patients, constipation could be related to obstruction. So those need to be carefully evaluated for. So in cases where they're vomiting and having symptoms of fever, and particularly if they're vomiting green colored bile, that sometimes can tell us that there's an obstruction. And so imaging can help. And sometimes that might require a surgical fix. Rarely, problems with the spinal cord can cause a problem with the way the nerves are distributed in the intestine, and that can lead to constipation. So things like deformity in the lower back, or if you have a small tuft of hair, or kids who have problems with urination, can also have problems with constipation. So in those cases, those other conditions need to be looked at to see if it can be treated in a slightly different way.
Okay. All right. Thank you so much. That was great information, and I learned a lot, as I always do. I thank you uh, for sharing your knowledge today. And this interview will be on our website, also in the magazine. And again, I thank St. Francis and the Children's Hospital at St. Francis and Dr. Josyabhatla for sharing his expertise today. And I, I appreciate.
Thank you. Thank you so much for having me. This was very nice. It was a great
I
conversation.
appreciate your expertise. So
Thank
thank
you.
you, and have a really nice afternoon.
Have a great day. Thank you.